Well, welcome back, everyone. You know, measles cases is on the rise, and here to talk about measles and vaccinations is Lisa Horstman. She's with the Allen County Public Health. Welcome, Lisa.
Good morning.
All right, so measles, you know, it's a very contagious disease, but it's also it's reoccurring more and more throughout the United States. Let's talk about that.
Yes, since the beginning of the year, we've seen over 1,000 cases, and actually in the year 2000, it was totally eradicated in the U.S., and so since then we've seen these outbreaks. In particular, this year is one of the highest.
Yeah.
And so we want to, get to providers, education, and parents, patients, just the need for vaccination.
Yeah, a lot of people, I think they focus on the dark web. You know, there's a lot of misinformation on the internet, of course, and people sometimes just believe what they see or what they read, and instead of going with the scientific facts that has been going around for generations. So let's talk about vaccinations. Those vaccinations are important, right?
Exactly, and the vaccination for the measles is measles, mumps, rubella. It's called MMR vaccine, and it's given at age 12 to 15 months, and then it's given again at 4 to 6 years of age prior to kindergarten school entry. Yeah. So 2 doses are required for school, and I've been giving the vaccine since I started nursing, and I wouldn't recommend it to my family if I didn't, believe in it. And specifically, if we're talking about measles, measles is so contagious that 1 in 5 unvaccinated children under 5 will end up in the hospital. Yeah. And they say, I also read that if you were in a room with someone with measles, 10 people, 9 people would get measles.
Yeah, it is definitely, I think it is the most contagious disease that's out there, yeah. Which is horrible. So right. Now, vaccinations, is it kind of like COVID where it doesn't prevent you from getting the disease, but maybe it'll combat the symptoms and all that stuff? Is that how it works still?
Well, 1 dose of MMR is 93% effective.
Okay.
So it has
That's
a very high effective rate. Yeah. And then 2 doses are like 97 to 98% effective. And so for children, they want them to have the 2 doses by kindergarten, but for most adults, some adults have called and asked, what are the recommendations for us? Typically for adults with no high-risk conditions or, depending on their job, health care, traveling, that would be more of a situation where you might want 2 doses, but typically 1 dose is enough for adults. But adults born before 1957, they consider to be immune. So
really, even if they haven't had measles?
Yes, they would probably have been exposed to measles.
Well, probably. I'm guessing so.
Because it was that much prevalent at that time.
Because it's so contagious.
Right.
So, yeah, so let's talk about some other vaccinations that are out there. What other vaccinations are typical and needed throughout our communities? Well,
we still vaccination for polio, for example, which is pretty much eradicated in the U.S., but other countries have polio, and so we want to make sure that vaccination rate is high. Tetanus, diphtheria, pertussis. We see pertussis still in the U.S., and that is one that's preventable with a vaccine. Meningococcal vaccine prevents meningitis or meningococcal diseases. Those are some of the vaccines that we want to make sure. Hepatitis B, the different hepatitis B vaccines would be others.
Yeah, so it's an easy process. You just roll up your sleeve and boom, there it is. It's done.
Right.
It's so easy.
Right. Right.
So some people may be scared of needles or whatever, and it's like, I'm one of those, to be honest with you. I don't like them, but at the same time, I've been vaccinated for different things, and it really, for me, it didn't even hurt. So
right. It usually is that way. Maybe a mild reaction, but very rare would there be any serious reaction. Exactly.
What are your hours for those?
So for the health department, you can call or go to our website, Allen County Public Health, and you could either make an appointment by calling or online. And we offer immunization clinics on Mondays, Wednesdays, and Thursdays. Those are our immunization days, so you'd want to call for a time. If time permits, we have seen walk-ins, but typically we like for people to call, make an appointment. And we have, let's say for the children on Medicaid or uninsured, we have the vaccines for children, which is no cost. And we offer, we provide vaccines with most insurance companies we're contracted with. So,
well, Lisa, thank you so much for coming in today, keeping our communities healthy. So
thank you.
I appreciate that.
Thank you.
All right, well, don't go away, because medical news is coming up next.